Hi, my name is Richard Sierzega. My presentation here is going to be about David Vedder, the Bubble Boy, which is a story about a child's life in the early 70s who lived his whole life in a sterile environment. The reason being he had to live his life under a sterile environment is that he was born with a disease. This disease is about the X-linked severe combined immunodeficiency virus disease and its impact on daily living. To learn about David Vedder's life in a bubble, his accomplishments, his struggles, and the ethical decisions his parents had to make, along with the physicians providing the care for him. And also to determine the physicians involved with David's care were ethically responsible for his life completely. To understand more about David, the Vedder's son, who was born with SCID, died at the age of 7 months before he can receive a bone marrow transplant. It was seen that Catherine was a perfect match, who was his sister prior to his death. So as a result of his diagnosis and death, they learned that any male children had a 50% chance of being born with SCID. The Vedders were devout Catholics who had strong morals and wanted lots of children. And David's mother was pregnant within 8 weeks of losing their first son. The treatment for SCID at that time was limited to isolation of a sterile environment prior to bone marrow transplants, and medical staff predicted a cure for SCID within 2 years. David's physicians previously treated 3 bubble infants prior to that. So what is SCID? And so to learn a little bit more about it, it's a rare genetic disease characterized by the X chromosome. It's a complete deficiency of T cells and NK cells. Normal number of B cells that are totally non-functional at all. So basically it's a child that has 0 chance of fighting any form of viruses or bacteria or diseases. It occurs in 1 out of every 100,000 babies, and female carriers only affects male babies, which is the key here. No immune system so extremely susceptible to infections, and exposure to pathogens often results in death. At that time, treatments for SCID was bone marrow transplantation. So preparing for David, an immunocentesis confirmed in utero that David was a boy. So fully aware of the risks, David's parents continued with the pregnancy. Given the 50% chance of David having SCID, clinicians prepared a sterile chamber for David during that time. So prior to the delivery, David's physicians created a plan for his care. 1, he would be delivered and then immediately placed in a sterile environment to eliminate infection. While in isolation, they would prepare a bone marrow transplant to occur. Preparing for David continued. As you see, he was delivered via a C-section on September 21st, 1971. He was exposed to the outside world for only 20 seconds before being placed in the isolated bubble. The bubbles were isolator contaminant centers designed by NASA engineers. Shortly thereafter, tests confirmed that David had SCID. The hope was that David's sister Catherine would be a perfect match, again for a bone marrow transplant. However, this was not the case. Did the medical staff offer Vedders too much hope? So about David Vedder, he was born September 21st, 1971, and he died February 22nd, 1984 at the age of 12. Treated by medical staff from St. Luke's Episcopal Texas Children's Hospital and Baylor College of Medicine, he was the first human to live 12 years in a sterile environment. His IQ of 126, and he was the oldest untreated survivor of SCID. David Vedder spent the first few years of his life at a Texas Children's Hospital until he moved home with his family. In 1973, David Vetter was 18 months old, and the chair of pediatrics at Texas Children's Hospital wanted to terminate David's care. He was overruled. In winter of 1975, David was two. Two meetings convened to discuss the ethical concerns associated with David's quality of life. Questions focus on the long-term quality of his life and issues associated with adolescence. When David was 4, he became more active and tried to poke holes in the bubble, and as a result, his doctor explained to him why he was in a bubble. Between 1975 and 1976, David's 3 primary physicians all left the hospital and stopped overseeing his care completely. In 1976, David's new physician had him evaluated by a group of psychiatrists who confirmed that David's mental status was deteriorating, recommending that were made to remove him from the bubble, and they were overruled. David was developing an intense fear of being in the bubble. On July 29, 1977, when David was 6, his mother held him for the first time. David was able to leave his bubble using an isolator and tunnel and specifically designed spacesuit from NASA. This required a 24-step pre-excursion hookup system and a 28-step suit zoning procedure. David only took 6 walks in the spacesuit. After that, he refused to get back in because of an overwhelming fear of germs. And there you can see an example of what he looked like at that time with his family and the healthcare staff. David Vetter, as he grew older, he became more depressed and aware of his illnesses. When he was 9, Boston researchers developed an experimental technique to transplant incompatible bone marrow. So he received the bone marrow transplant on October 21st, 1983 from his sister, Catherine, who was not an exact match. He developed a fever and intestinal bleeding, and shortly after, David died 4 months after the transplant from lymphoma, which was introduced into his system as a result of the Epstein-Barr virus. David's mother touched him for the very first time on that day he died. It was estimated that David's annual care cost approximately $200,000, which was covered through research grants from the National Institute of Health. And we can only imagine what that cost would be today if he was born in today's world, if we did not have advanced care for bone marrow. David's last name was not disclosed until more than 10 years after his death. So the outcomes: David's autopsy showed that his sister bone marrow contained traces of dormant virus, which caused David to get sick. This was the first direct proof that a virus could cause cancer. More than 90% of infants diagnosed with his disease are now successfully treated with bone marrow transplants. Long-term isolation is no longer a treatment option. The ethical implications: doctors originally thought David would be removed from the bubble within a few months. When they discovered that his sister wasn't an exact match, the doctors developed a new plan, which included looking for other matches. And regardless of anticipated that David could outgrow the disease by the age of 2, which did not happen. By this time, the physicians were in uncharted territory. Ethical implications again continued. He was compared to a rat in a cage. Others considered him to be a research subject. Ultimately, a staff of 30 clinicians at Texas Children's Hospital agreed that it was ethical for David to live in a bubble. Studying David's blood cells led to effective treatments for SCID. So the non-maleficence: if one cannot do good, then one should at least do no harm. And if doctors couldn't cure David, they at least needed to protect him from harm. And paternalism: one person assumes authority to make a decision for another, justified only to prevent a person from coming to harm. And although David's parents made the final decision regarding David's care, They were guided by David's team of physicians. And that summarizes my story of David in a bubble. Thank you.